mean, I don't know if shocked is the right word, because I guess I always knew that there was a possibility, it could be cancerous, but I was just very, very, very shaken by that news. And just, I almost didn't even know like what to do next. It was just, kind of like a nightmare coming true. Probably around the middle of 2013, I just started having some issues with my right elbow. I couldn't completely straighten it, and it hurt a little bit. And the left side of my neck also was bothering me a bit. And initially, I didn't really think anything of it, but it didn't go away. So I first went to see my primary care physician, who pretty much, kind of took a look at me, said, you know what, you're 47, how have you been using your computer, holding your iPad? And pretty much said to me that he thought it was just an overuse injury. And to be honest, I just completely agreed with him, because it seemed like that, totally made sense. And no one could really figure out why my elbow, which they had deemed tennis elbow at this point, wasn't responding to any of this treatment. My neck, oddly enough, started to feel better, but my elbow didn't. And I eventually ended up at an orthopedist who specialized in the wrist to the shoulder. And he did an MRI of my elbow, because he was trying to figure out what was going on, and saw that there was a mass in there that was on like the joint, and looked like it had actually eaten away a little bit of the bone over there. And he didn't really know exactly what to make of it. So he sent me to an orthopedic oncologist. Now, when I went to the orthopedic oncologist, I mean, I obviously was already terrified, because the word oncologist is in the name, and I went with all my various reports and everything. And when I first saw him, he honestly kind of took a look at me. I looked healthy, good shape, everything. And he said to me, if you presented differently, I would think that this was a metastasis, possibly from somewhere else. But I'm really, really like 95% sure that this is a benign condition called a giant cell growth. And I'm going to do a biopsy, no rush to get that scheduled. We'll go in, take a look at it, and if that's what it is, take it out, and you're pretty much good to go.
Right, right.
Well, all of that happened, but it wasn't benign. I was actually getting kind of frustrated, because I was being really good at following everyone's recommendation for the next doctor. I was doing all my physical therapy exercises. I was, getting my cortisone shot. I was following up, and nothing was improving. So I was getting kind of frustrated. But then on the other hand, there was a little piece of me that also kept thinking, do I just keep pushing forward? What if, this is, like my husband and I talked about it, and he said, well, how I have problems with my knee, and this is my thing now, I have, a kind of an arthritic knee. I mean, maybe this is, people get older, and maybe this is going to be your weak spot. So, I mean, part of me was thinking, how much am I going to keep going to doctors and trying to figure things out? But it just seemed odd. And that the whole elbow thing kept getting worse. It wasn't like it was getting better. And I kind of got to the point where just putting my hands up to wash like the back of my hair hurt. And I was 47 years old. That just didn't seem right. So
Right,
I kind of kept going and was determined to figure out what was going on. And
right.
it took a good 6 months for that to
Right.
happen. When the results came back that it was malignant, it came back as adenocarcinoma. So that's how that doesn't originate in the
Mm,
bone. So
right.
they knew at that point that the cancer I had came from another part of my body.
Interesting.
And I remember asking the orthopedic oncologist, so where does adenocarcinoma come from? And he said either the lungs or the breast. So initially, I was convinced I had breast cancer. I mean,
Right.
at that point, I had no idea that lung cancer was something that I could get. I didn't realize, what I know now, that all you need are lungs to get lung
Right.
cancer. I didn't think I had any risk factors. I was pretty nervous after I had the biopsy, even though my oncologist at that point had said that he was kind of pretty sure that it wasn't going to be anything. I was still nervous. And it took a good amount of time, it seemed like, before I had results back. It took probably a couple of weeks. My oncologist called, and he actually wanted me to come into the office and set up an appointment, but I already knew what he called. It's not good news if an oncologist who already said he thinks 95% chance this is benign tells you he wants you to come into the office to get the news. So I pretty much convinced him on the phone to tell me what in the world was going on. So that's when I had the conversation about how it was malignant and it was adenocarcinoma. That was over the phone. I have to say that I was just, I mean, my stomach dropped. I mean, I just was. I mean, I don't know if shocked is the right word, because I guess I always knew that there was a possibility, it could be cancerous, but I was just very, very, very shaken by that news. And just, I almost didn't even know like what to do next. It was just, kind of like a nightmare coming true.
Right.
I don't think it took that long for me to get the PET scan scheduled. It was within a week. I went in to have the PET scan. But this was sort of the beginning of, a whole new language. All of a sudden people were talking about PET scans and, and getting contrast injected and other scans that I might need, CT scans, brain MRIs. I mean, it's kind of overwhelming, when you go from, just being, your normal everyday person to entering kind of the world of oncology. And there's a lot of terminology that you need to learn about. And, you're learning about this at a time that you are at your most vulnerable, because you're terrified about what's going on as it is. So it's kind of hard to take all of that in. Fortunately, after the PET scan, I didn't have to wait very long to find out the results. I actually found them out the same day while I was still in the hospital. I'm, treated in major medical center downtown Chicago. So it was a quick process. So I remember my husband and I went, got some lunch, and by that time, it was time to get the results of the scan. And, I sat down with the orthopedic oncologist, and he basically told me that they found that from the PET scan, there was some areas in my lung that had lit up, mostly a, almost 3 centimeter mass in my upper right lung. There might be other, small little nodules, but that was the main area. And that they had found that the elbow mass was also, that also lit up. There was an area on my neck where I had the neck pain that lit up, and there are a few other bones that did as well, my rib, my pelvis. So he told me that that was, considered metastatic lung cancer. And the next stage would be for me to talk to a thoracic oncologist. It was almost surreal. I mean, I have to say, I mean, I literally don't remember a lot about, those, few days. It's all a blur, because I was just trying to process everything, and I was very upset and crying
Right.
tons, and but also feeling like I wanted to hide that from my kids.
Yeah.
So it was kind of a, a crazy time. It
Oh,
really was.
wow.
I didn't know this, but I guess once they had determined that it was lung cancer, they my hospital automatically, and this was at Northwestern downtown, automatically sent my sample for molecular testing. And since this was back in 2013, they didn't test for as many things as they test now, but they tested for EGFR, ALK, and KRAS. But I didn't know any of that was going on until I got a call from the nurse who works with my new thoracic oncologist, who I hadn't even met yet because my appointment wasn't going to be until January, and I think she called me a couple of days before, and she told me, she basically, was calling and getting my information. She said to me, and let me ask you this, has anyone, talked to you about molecular testing? And I said, well, no, I've actually done some reading about it because, I had, but, she said, well, I want to let you know that you have an EGFR mutation, and that's actually a good thing because we have, drugs and medications that you can take that can, target that in their oral pills. And she started explaining it to me. And this was before I even met my thoracic oncologist. So that, I can't say that it completely calmed me down and made me feel like there was some hope. And it also kind of changed completely how I was thinking my treatment would be, because I initially thought, as a regular person who doesn't have a background in science and oncology, I mean, I had never heard of targeted therapy. I mean, I thought that my treatment was going to be what you think of when you think of someone with cancer. You have chemotherapy, you lose your hair, you're sick. But I found out from her that it was going to be a very different type of treatment. So
Yeah.
that was kind of the one bright, kind of ray of sunshine that, kind of clicked in before I actually met my oncologist. I had mentioned that I found out I had an EGFR mutation while on the phone with her nurse before I came into the office. But when I went for my first appointment, Dr. Patel suggested I have a few more tests, one of which was a brain MRI, which I hadn't had at that point. And that's when I found out that I also had 8 small lesions in my brain, in addition to the bone involvement. Um, as a result of all of these kind of additions, Dr. Patel decided that it would be a good idea for me to speak to a neurosurgeon and to a radiation oncologist in the hospital before we made the final decision about starting me right away or not on an EGFR targeted therapy medication. So the neurosurgeon talked to me about the pros and cons of having surgery before I started on treatment for my EGFR mutation. And that was one of the visits that I made that day. Then I also went and talked to a radiation oncologist that day who talked to me about the pros and cons of having radiation on some of those brain metastases prior or after starting my targeted therapy. I think the concern there was that if there were if there were 8 small lesions that could be seen, there might be more that were lurking that, might not even, have shown up on the MRI. So she kind of gave me the impression that at some point I might need to do whole brain radiation. So I have to tell you, so I did those 2 appointments and went back to Dr. Patel. And I mean, if I could say that I was, I started in, when I went in that day being somewhat terrified, I was beyond terrified by that time. My husband was with me, so, I had that support. But to tell you the truth, it was just so overwhelming. Now, I do have to say, I am very glad that I had all those conversations, and I'm very glad that all of those doctors weighed in with their opinions, and Dr. Patel talked to them, and they really figured out, what would be the best approach. By
You,
speaking together and working
right,
together. I'm very, very glad that happened.
right.
Um, it turned out that Dr. Patel felt that by starting me on a targeted therapy for my EGFR mutation, which she did explain to me is could basically shrink the tumors or even have, them disappear all or in part,
Mhm.
that might take away the brain metastases and reduce the tumor in my cervical spine.
Right.
So the concern with my cervical spine is was whether that tumor was actually keeping my cervical spine from collapsing.
Oh,
So that's where the neurosurgeon came in. I mean, I have to say, I mean, you really need to when you're first diagnosed, I mean, I felt fortunate that I had found a doctor who I really felt like I trusted. Okay. From the moment that I talked to her nurse and the moment I talked to her, I felt like she knew what she was talking about. I had already verified that with, the other lung cancer survivor who I had mentioned earlier, and I felt like I trusted her. And she listened to my questions. She tried to get to know me as a person, and I decided at that point in my diagnosis, I needed to go with that trust, and I needed to allow her and her clinic to coordinate all my appointments and tell me what I needed to do next. Now that worked for me. I don't know if that would work for everyone depending on who your initial doctor is, who you start with, but there really was no time for me to go get a second opinion either because of this concern about the lesion on my neck.
right,
So
right.
that basically, I mean, I listened to her, and I left the hospital that day with a prescription for my targeted therapy and wearing a neck brace, which I had to wear for 3 months so
Mm,
that was the concession to the neurosurgeon,
right.
that if I felt like the slightest bit of pain or increased pain in my neck, I would go back and see him. And I did have to have regular follow-ups with him for a while, every couple of weeks, just to see how my cervical spine was doing. There were side effects that I experienced. Very common side effects for these type of TKIs are rash and diarrhea and dry skin and split fingernails or even the skin around your fingers. And just a certain extent, at least at the beginning, I experienced all of those. But again, I do have to say that my oncologist was very thorough about letting me know what, and her nurse, what to expect and what I could do from the very, very beginning to try to be proactive to get ahead of those side effects. I, gargled with a mouthwash for mouth sores. I had a prescription to put on the rash if it developed, and even an antibiotic to take to prevent it from getting worse up front. So I went into it kind of armed very, very well with ways to deal with and handle the symptoms the side effects, I mean, that I could develop.
Right.
And it wasn't that difficult of a process for me, but I was also very fortunate that I developed what seemed to me as, a good amount of side effects, but what I was told was a very mild case of most side effects.
Good, good.
And over time, I learned how to manage them.
Yeah. You got out
Very
ahead.
fortunate that, my first targeted therapy worked great. And my um, the bone in my neck that they were very concerned about um, grew back.
Right.
And yes, and I still remember after a couple of months of visiting my neurosurgeon, him saying, "Okay, well, we're not going to have to do surgery." He said that there was a profound improvement
Mm.
in my cervical spine. So, that was amazing.
Right.
All of my brain mets disappeared.
Wow.
They just disappeared. And my lungs, a little bit of nodules I had here and there disappeared, and my main tumor shrunk, a good amount, but didn't completely go away.
Okay.
And I felt pretty good, and those results continued for close to 3 years. Yeah, so I've been on osimertinib now for a little over 4 years. What happened, and it's interesting because my changes in treatment always sort of um, go along with my oncologist changing hospitals. Okay, so at the very end of 2019, my oncologist went back to Northwestern from University of Chicago. These are all promotions for her. So, they're wonderful. And, it's in the Chicago area, so it's not that difficult for me. But it always does kind of make things a little confusing in terms of my scans. So when that happened, again, there was some question about whether there was some progression in my lungs or not. And still, no one even knows whether there was or not. But, a lot of time had passed at that point. And at that point, I was 6 years out from my initial diagnoses. And while I was first diagnosed, no one would ever, suggest a stage 4 lung cancer patient have surgery. It was kind of becoming, well, I wouldn't say common. It was kind of becoming an option for some stage 4 patients to be able to have, more of an out of the box treatment, whether that meant surgery or whether that meant radiation of their primary tumor in order to hopefully improve their overall survival. So initially, when it was kind of questionable whether it was growing again, my oncologist said to me, "Well, how would you feel about just getting your primary tumor radiated, since that's the only place where anything, in your entire time since diagnosis has even grown?" And I thought that that was, a good idea. It went to tumor board at my hospital, and they came back and said that I was a candidate for surgery. So I decided, well, if I was a candidate for surgery, I would rather even do that than radiation, because I could just get an entire lobe of my lung out where
Mm.
all of the cancer was, and hopefully not have side effects that might come from, radiating that
Radiation.
area of the lung. And that's what I ended up having done.
Wow.
Just about a year ago from today, I had surgery, had my upper right lobe removed, and as a result of that, became NED, no evidence of disease. And it's a year later, and I still have no evidence of disease. I have to tell you, I think it is critical to make sure that, you take care of your mental health as well as your physical health if you go through something like a cancer diagnosis. And you shouldn't, feel in any way ashamed or like you don't want to ask for help, because my gosh, I mean, a cancer diagnosis is a big deal. And people, I mean, shouldn't feel like they need to know how to handle that. I mean, if anything, it's a huge, huge stressor. So, I mean, I cannot imagine having been able to handle, living with lung cancer for over 7 years without having a therapist, without having being on an antidepressant. I mean, it has really kind of helped me be able to keep myself in a good, stable mindset, in addition to being stable with my cancer, so that I can live a good life and, balance. Like, you don't want the cancer to become your entire life. So
Yeah.
I'm able to talk about other things and be here for my husband and my
Mhm.
kids and my friends and,
Yeah.
my 89-year-old mom. I mean, the impact, I can't underestimate the impact of taking care of my mental health,
Mhm.
because it's made it so that I'm not just surviving with cancer. I'm actually living my life
Yep.
fully with
Yep.
cancer. And I don't think I would have been able to do that if I hadn't made that a priority. The biggest message that I can share is just, I think, the message of hope, to tell you the truth. I mean, things have changed so much in lung cancer in the 7 years since I was first diagnosed. And 7 years isn't that long in the grand scheme of things. When I was first diagnosed, I mean, immunotherapy didn't even exist. It was kind of like science fiction. I mean, people were talking about it, but they didn't know what kind of promise that would have. Half of the mutations that are now being, tested for in lung cancer hadn't even been discovered yet. And if you go back beyond my 7 years, another decade, all lung cancer patients were pretty much treated with the same one or two chemotherapy drugs. So, in such a relative short time, we have come so far. I think, I mean, this is kind of, a good time to be, a lung cancer patient. If end up being a lung cancer patient, there are so many developments and there are so many new ideas, and patients are living longer and better with lung cancer because of these new treatments. And there's such a potential for more upcoming treatments.